A shameless plug here for the Lancaster Health and Wellness Fair, which is October 2nd. We're actually sold out of vendors, and there's a lot of good people who are coming, not only just to give you, you can pick up information. Our police, our fire is coming, Commission on Disability is coming, a lot of private vendors, the Alzheimer's Association. So hopefully you can come to this, and we have free popcorn and apples. We always have to throw the food in, right? So today you have some of my favorite speakers and presenters and some friends, good friends. They're wonderful people, so we're really fortunate to have them. Thank you so much for coming, Ann and Tamara and Whitney. So you saw the practical right now about how to exercise, and now you're going to get some tips, and here are some of the reasons why you really should be here today. So without further ado, I'm going to introduce Anna Zola from HomeAdvisor. Yeah, oh my goodness. And she's a board member, technically my boss.
Oh yes, well, that works for me, yeah.
How could I forget that? And Neshoba, you may not know, but we have an incredible resource with Neshoba Nursing and Hospice. And some of you have had the occasion to use them, but we contract with the town of Lancaster through the Board of Health. But they're here once a month to the town nurse to check your blood pressure. But they're going to be giving shots at the Health and Wellness Fair, so get your flu shots early because there's lots of predictions about the year. Who knows? It's kind of like the length of winter. We'll see what happens, right? But get your flu shots. And they're a great resource. Hopefully you say hi to everybody afterwards.
Wonderful. Thank you. Well, thank you, and I'm so glad you guys could be here today. There is a handout on fall prevention, some tips that we share with our caregivers at home instead to help keep their clients safe, so hopefully they can keep you safe as well. So it's going to be pretty casual here. I'm going to try to keep it to about 20 minutes, but anybody who knows me knows I'm long-winded, but we will keep it so you can get a nice lunch in and take questions at the end. I'm going to stand over here so I can see the screen. I hope you can all hear me, because the way the sunlight was coming through, I couldn't see what I'd be pointing out to you, so I thought that'd be kind of important. So we're going to talk about fall prevention, and the objectives that we have for this little presentation is discussing the signs that you may not be aware of that can increase your risk for falls, 6 ways we'll talk about that you can help prevent falls, and then identify resources. There's some of them right there that you can tap into to keep you safe from falls. So, let's talk about fall statistics. I'm not talking about the leaves changing color and falling to the ground. We're talking about falls, and this is a good time of year to do this, because at some point we're going to be thinking about winter. How can we winterize our environment to be able to be safe and prevent these falls? So it's a pretty scary statistic for those of us over the age of 60. Falls are the leading cause of fatal and non-fatal injuries. 1 in 4 adults will fall yearly. That's not a one-time deal. That is every year. And 1 out of 5 falls are going to cause serious injury. And here is a really scary statistic. Every 11 seconds, a senior is treated in the emergency department for a fall. So, what does that mean? Well, it means that according to the CDC, as populations get older, the risk for fall is increasing. And from 2007 to 2016, you can see that there has been a huge increase in the number of falls, to the point where there is estimated that there will be, right now, there's about 3 falls that people die from each hour in the United States. By 2030, if this trend continues, that number could rise up to 7 people dying per hour. So it has a lot of impact, obviously, on our adult population. And here's the thing. When we talk about aging and how often a fall can occur, Please don't think that falls are a natural part of aging. They're not. There are certain effects of aging that we're going to talk about that can increase our risk for falls, but it's not inevitable. But do know that if you are older and you have a fall, your chance doubles of having another fall within the year. Falls often result, as we said, in injury. But here's the thing, what this isn't taking into consideration are all those near misses. You know, the ones where you kind of stumble a little bit but you don't fall. Or maybe you fall but you just get a little bit black and blue. You didn't break anything, you don't have to go into the hospital. But those are serious risk factors for falls with injury in the future. And the types of injury that we're going to see most frequently with a fall are hip fractures, broken bones, head injuries, and of course when you have an injury like that, it can limit your independence. And what most people don't realize is that after a hip fracture, 40% of people, that's almost half of the folks who fall and fracture their hips, do not return home again and be able to take care of their what we call activities of daily living, being able to drive, being able to take care of all their personal care needs. And it's not just expensive to us as people, as being able to get around the cost that is, but it's also very expensive in costs that are more tangible with money. The average hospital cost for a fall with injury is $30,000. And of course, there is a physical and an emotional impact of that in addition to the financial impact. It's going to elevate your fear of falling. And of course, you want to prevent falls, but we're also finding that people who are afraid of falling tend actually to do less of the things that can help them have a better chance of not falling in the future because of that fall. It's going to limit activities, your social engagement, and it can lead to further physical decline. If you were active before your fall and now you're not, nobody gets better with inactivity, and truly, over the age of 60, it is absolutely use it or lose it. And it can increase the risk of depression, social isolation, and feelings of hopelessness. So, what's going on? How does aging have an impact on possibly falling? Well, the first thing that I just talked about a couple of seconds ago, inactivity. We tend to not be as active when we're older as when we were younger. And we may have some mobility issues in there, either because of chronic illnesses or past falls or injuries and so forth. One huge impact that people don't always take into consideration is medications, and we're going to be talking about that briefly in just a couple of minutes. Also, eyesight and hearing. And people say, well, what's that got to do with a fall? Well, because how you are able to see, what you are able to hear, helps you to navigate your environment safely. So if you can't see that obstacle on the floor, you're going to be much more likely to trip over it. And if you can't hear that your pet just came running up to you, you might trip over your pet. And I can tell you, a lot of the clients we have at home instead do indeed end up in emergency departments because of tripping over a pet. Another thing that you may not think about is, how do you eat? We tend to eat less as we get older. It's a chore, right? Putting a meal together and shopping and thinking about all that kind of stuff. And our appetite can decrease over time. So what that means is, when combined with inactivity, you can lose muscle mass, you can lose muscle strength, and not be as able to prevent falls in the future. So what are some of the common risk factors? Well, physical, we just talked about, right? There's some changes to our physiology as we age. And behavioral, some of the things that we do is not to prevent falls. Maybe we don't always have our houses set up to help prevent a fall. And then some of the things that we do, but can make a difference in maybe preventing a fall in the future. There are environmental factors to think of, hazards in the home or in the community, and we're going to be talking and taking questions about some of the ways that an occupational therapist, we just happen to have one right here, can help you go through your home and determine, okay, I know I need a grab rail in the bathroom. but she or an occupational therapist can tell you where does that grab bar go? What angle should it be put at to keep you safe? So now let's talk about the 6 things that you can do to help fall-proof yourself, okay? So the number 1 thing that we have up here is exercise, which is why I am so happy that you were able to participate and learn some exercise techniques this morning. Regular exercise reduces the risk for falls, period, end of conversation. Unfortunately, most of us don't exercise as much as we did when we were younger, and that, of course, can be for a whole host of reasons, physically, emotionally, socially, right? But if you haven't been exercising for a while, do make sure you consult with your healthcare provider to make sure that it is safe for you, because we know physical activity can help prevent falls, but we also want to take into consideration your own physical health and ability to be able to do this. Popular exercises for older adults, and I can't stress this enough, Alex mentioned it as well, strength or resisting training. I used to be a PE instructor at Atlantic Union College, and I would always ask my students at the beginning of the semester, okay, there are 3 components to exercise, cardiovascular, strength, and flexibility. Which one's most important? And they would say, oh, it's cardiovascular, right? You want to keep your heart healthy. And for younger folks, that's absolutely true. But over the age of 60, it happens to be strength. Because if you don't have the muscle mass or the strength to even lift your arms, you're not going to be doing Tai Chi, you're not going to be doing chair aerobics, you're not going to be doing anything. So strength is important, followed by balance exercises like yoga, like Tai Chi, which we offer here at the community center, so please take advantage of it. It's a great way to get out, meet people, and work on your balance issues. Walking indoors or out. I'll tell you, if you have some depth perception issues and you can't see sidewalks as easily as you did when you were younger, go take a walk at the mall. There's lots of different places where you can walk to get that activity. And as I said, chair exercises. There's lots of things that we can do that get our heart rate up, that move those muscles, that increase our flexibility just sitting in a chair. So what's the second thing we can do? Discuss your situation with your healthcare provider and talk about what concerns you might have. Have you had some of those near misses in the past and you want to prevent them? Maybe you've got some tingling in your feet, in your arms that makes it difficult to walk. Are you having vision problems? Even things like not sleeping well at night can have a huge impact on your ability to do exercise during the day. So talk to your healthcare provider about that. And please bring a full medication list to every doctor you go to. And when I say medications, I don't mean just the things you need a prescription for. I mean over-the-counter medications, herbal supplements. I teach a course on safe medication, and I can tell you I want my head to explode every time I hear them saying, oh, it's all natural. It's not a medication. Yes, it is. And you want to make sure that all of your medications are playing nicely with one another and not setting you up for a potential fall. What else? Ask for referrals for vision, for hearing, for OT, to make sure that these things that help us, again, navigate our environment safely are up to date for you, and anything that needs to be treated is being treated. And talk about your physical activity levels. What do you like to do? What can you do? Are certain things causing you problems when you do them? And see if there's a way around that. Inquire about assistive devices. You can use canes, rollators, walkers. All of these things can come in very handy. Maybe you don't need them to navigate around your house, but when you go out, you do. So make sure that if you need a cane or a walker or any of these devices, wheelchairs and scooters, these things usually when they're prescribed, and correct me if I'm wrong on this, if they're prescribed, you can usually get covered, some of these things, through insurance.
Yeah, canes and walkers specifically.
Exactly.
Wheelchairs.
So take advantage of that. And ask about community resources. You've got a wonderful one right here in the community center. But there are other resources out there, like our nurses, for example, who can help you with some of the day-to-day management of this. And then ask for a risk evaluation. You guys would know more about this study. It Stop Elderly Accidents by Death and Injuries, which is a program that can help you assess what your risks for fall are and other types of things that you can now hopefully prevent before these things happen to you. So the third thing we want to talk about are the medications, and you've already heard my little speech about keeping a list of them and making sure that everything you take, a vitamin pill for goodness sakes, is indeed a medication. And then you want to reconcile them regularly. What does that mean? That means if you see, like a lot of older folks do, a primary care physician and a whole host of other doctors who may be prescribing you prescribing you medications, they may not know what the other person is prescribing, and some of these things can have very serious side effects. So I always tell people, keep your PCP, your personal care physician, apprised of every medication that you've been prescribed, and one of the best people to assist you with that reconciliation is your pharmacist. So it's really important that you have one pharmacist that all your medications are prescribed through, because your doctors may not know that this other doctor prescribed a certain medication that could have very serious side effects with the new medication that they're prescribing. Also, doctors tend to treat the same types of illnesses. That's what they specialize in. So they're not going to have the broad base of knowledge that your pharmacist has. So reconcile your medications, and if you're having trouble seeing those tiny little labels and how many you're supposed to take and when the expiration date is, you can get large print labels on them. And be aware of any side effects first when you're taking a medication. Again, because the medication itself may have those side effects, or it may be interacting with other medications. And then if you have some of these side effects, please report them to your healthcare provider so that the determination can be made, is this still safe for you to take, or is there something else that you should be taking? And ask for help to determine if any of these meds or dosages need to be adjusted. Please don't do it on your own. I've had a lot of folks say to me, oh boy, I didn't know those two interacted. I'll stop taking X, Y, and Z. Oh, please don't. Always call your provider before stopping a medication, especially if it is prescription. And the types of medication side effects that we are particularly going to be aware of is if it causes dizziness or lightheaded. Some medications cause a drop in blood pressure. So you're sitting in a chair, you're feeling fine, you go to stand up and woo! That can be a side effect of medication and can absolutely have an impact on balance and those types of things that can help us stay safe when we are navigating our environment. Also, too, there are some medications out there that you're not going to be as cognitively clear, shall we say. And it's not that, oh my goodness, I'm getting older, I must be losing it. That may be true, I know it is with me, but in a lot of instances it might be a side effect of medication, so you always want to check that out. Okay, blurred vision, of course, that goes without saying. That's a side effect that you would need to get on top of, because you are certainly not going to be able to navigate your environment safely when you can't see your environment. What else? Vision and hearing. As we said, these are things that we don't think of for fall prevention, but we really should, because of the impact it has on how we're able to move around safely. So make sure you have regular eye exam schedules, that your glasses are the current prescription. In a lot of instances, we're all trying to save money, and you check and you see what the new price is going to be on your glasses. You're like, well, my prescription didn't change that much. I'll just keep the old ones. Not a good idea. And be aware of any changes in your vision. Even if you've just had a doctor's appointment, things can change rapidly, specifically with age-related macular degeneration. That's when you're reading a paper and all of a sudden you can't see the center of the page, the words go away. Cataracts can become worse, so make sure that you have current information and that you bring it to your doctor if anything changes. One thing you can do, a nice tip to help you see if you do have some issues that are only correctable to a certain extent with your glasses, you can put a bright strip of tape on the bottom and top stairs of a staircase to help you see them. Because in a lot of instances when people have an accident on the stairs, it's because they missed a step. So just common sense things like that can help as well. And if there is a surgical remedy, cataract surgery, for example, you may want to consider this so that your vision can be improved. Have your hearing tested regularly, and oh my goodness, if they do say you need hearing aids, please wear them. I have an awful lot of clients who have had hearing aids prescribed to them, but for whatever reason, they don't like to wear them, and that can be a dangerous situation. So if you need hearing aids, please make sure you're wearing them. Also, we want to talk about nutrition. As I said, nutrition aids in strength, and that is going to help us with our mobility. The important nutrients that you want to pay attention to are protein. Doesn't have to be from an animal if you don't eat meat products, but a lot of other things will give you high protein levels. You can check the list of ingredients on the foods that you eat. It will tell you how much protein is in there. You definitely want to make sure you're getting enough vitamin D and calcium, because these are the nutrients that can help keep your bones strong. A lot of people think with osteoporosis, for example, that a person falls and they break their bone snaps. When actually what can happen is just during your normal activities, you're walking along, your bones are weak, the bone snaps, and then you fall. So be aware of what those levels are and keep those bones nice and strong. And for goodness sakes, I know that a lot of us as we get older take pills for a variety of reasons that can cause us to need to use the bathroom frequently. So what will happen a lot of times is people decide, well then, if I'm taking this pill that's going to cause me to use the bathroom, I'm not going to drink a lot of water because I'm going out and I don't want to have to use the bathroom. Bad idea, because dehydration can cause some of those side effects we were just talking about: dizziness, blurry vision, lightheadedness, and of course all of these things can lead to a heightened fall risk. So those are the things that you can do, be aware of to help prevent falls in your future. Now let's briefly talk a little bit about home safety, because falls commonly occur at home. Of course they can occur anywhere, but they do tend to happen more at home. And where do they happen? In the bathroom and the kitchen, those lovely rooms with nice hard surfaces. And in the case of your bathroom, you take a shower, you've got all that humidity, the floor is slippery, you step out of the shower and whoom, down you go. So be aware of that and know what the key safety considerations are. Remove those little scatter rugs or tape them to the floor. I found this out from an occupational therapist. One of my clients had some beautiful oriental rugs and did not want to be getting rid of them. They were gorgeous. But she was now using a walker, and they were afraid that she was going to catch the end of the walker on that rug and over she'd go. So I found out that duct tape, believe it or not, if they say you can solve everything with duct tape, I think you can. It comes in just about any color you can imagine, and the occupational therapist had my client's husband put a strip along the edges so that the walker would go right over it and not catch on the edge. So things like that can work. Pay attention to lighting. Make sure the areas that you are using most frequently are well lit. Grab bars really are a must for bathrooms, for getting up off of the toilet, into the shower, whatever the case may be. And you should have railings on both sides of the stairs. Maybe going up you got a railing, but coming down you don't. So having railings installed will help, and pay attention to slick surfaces. Nobody should ever be walking on a hardwood floor in your socks, or in the bathroom on the wet tile floor in your bare feet. Make sure you're wearing the appropriate footwear, and make sure that those areas are dry. We already talked about pets. We love them. I know that I never want to be without my dog, but I also know that my father couple of years ago tripped over one of our dogs and fractured his pelvis. So it can absolutely happen. Make sure your pathways are clear. It's very easy not to see something. And if it's something you're walking with a walker, that can get stopped on whatever is in your pathway. The walker will stop, but you won't. So you want to be careful with that. And of course, make sure any exposed cords, cutter, that type of thing is removed from your walkways as well. Another thing that I really suggest that has helped a lot of our clients is storing frequently used items at the appropriate height. If you have to stand on a chair and balance on one foot to reach something in the cabinet over your refrigerator, this probably isn't the safest thing that you can do. So if it's something that you use frequently, have it brought down and store it at a level at about waist height, so you don't have to put yourself in a position to increase the risk of falls by reaching for it. So let's finish up by talking about how we can winterize. And what you want to do is pay attention to just not your home environment, but the things that you wear as well. So winterize your shoes, your boots, your assistive devices. There are things that you can put on the bottom of these devices. Some of them, I know on a cane, looks like a little ice pick. So when you put that cane down on an icy surface, instead of it sliding, it's going to grip and give you stability. You can do that for your shoes as well. There are things that you slip over the soles of your shoes. Make sure you're wearing shoes that have a nice solid sole on them as well, so that you will have the grip that you need when walking around. Believe it or not, when I found out this, I thought this was pretty amazing. I know that there are snow tires for cars. Did you know there are snow tires for wheelchairs? I had absolutely no idea. So if you are out a lot in the wintertime and you use a transport chair or a wheelchair, look into getting those winterized as well. Another thing you can do is just carry a little plastic Ziploc bag with some kitty litter in it. So if you are out and it's like, oh, I thought they would have taken care of this sidewalk by now and it looks a little bit slippery, you can sprinkle some of the kitty litter on it, let it sit for a couple of seconds, and that's going to give you a little grip so you can walk on it more safely. So, what else? This says give the gift of fall prevention. I'm saying ask for the gift of fall prevention. How many people here have folks who say to them, oh, I just never know what to get mom or dad or auntie or whomever for Christmas. They have everything they need. Oh yeah, well this is some of the things you might want to have. How about a fall alarm, like a light alert or a great call system? Or having new toilets put in. I know now, I'm so used to sitting on the newer toilets that they put in, right, that if I go into a home where there's a little toilet, I almost fall in sitting down onto it because I'm so used to the taller toilet. Also, too, if you don't want to invest in new eyeglasses, as I said, your prescription hasn't changed that much, maybe a family member can give you some of those. Grab bars as well. Railings, as we talked about, on both sides of your stairway. And automatic lights, so when you're walking down the hallway, the light turns on. You don't have to fumble for a light switch in the middle of the night. And then just, small flashlights that you can carry around with you. Asking for an assessment from an occupational therapist is a great thing to do as well. So finally, these are things you need to be thinking about now, not after a fall happens. Prevent these falls. And believe it or not, when I tell people this, they're like, you gotta be kidding me. Start this in middle age. 40 to 60 is actually ideal. And understand your fall history. When I say falls, I'm talking about those near misses as well, not just a fall with injury. And if you do have some near misses and you do have some falls that didn't result in serious injury, keep a journal. Where did you fall? What time of the day did it happen? How did you fall? What were you doing? And again, standing on one foot on a stepladder to reach something over the refrigerator probably should tell you not to do that. And how were you feeling? Were you dizzy when you had this fall? What was going on that you think could have been contributing to it? So, that's how we try to prevent falls. I know these ladies will be taking some questions about that, maybe giving you some information. But even with the best laid plans, a fall can happen. So if you do fall, what do? First of all, and this is one of the most difficult things, remain calm so you can think clearly. If you are injured, do not attempt to get up. You can injure yourself much more severely. If you are wearing a medic alert, push the button or call 911 and then your family. Call emergency response first. So I always tell people, like, well, if I'm not wearing an emergency response monitor and I'll fall down, how am I going to call 911? So I tell people you should always have on your body a charged cell phone so that in the event you do fall, you can call 911. Provided you didn't fall on the cell phone, that of course is a separate issue. If you feel after doing these things that it is safe to get up, and by the way, please don't feel badly about dialing 911. I can't tell you how many times emergency response people come out just to help you up. Yes, they will offer to take you to the hospital to be checked out. You can refuse if you don't think you need to go, but that is part of their job to help you up if you need them. So please don't feel funny about that. But if you feel it is safe to get up, and you know that you haven't hit your head or you're going to compromise yourself further by trying to get up, you can roll onto your side, take a nice little rest, nice deep breaths for 30 seconds or so. Then get onto your hands and knees first. And again, rest, nice deep breath. Get over to a sturdy chair, even if you're crawling on your hands and knees, if you can do that. If you can't crawl on your hands and knees, that means it's not safe for you to get up. Make sure you stay down. And then you put your hands on the chair, one foot up, and hoist yourself up, if, again, you can safely do that. Okay? Slowly rise, get yourself in the chair, and see where you're at. I've got a list of resources here that if anybody is interested in more information about any of the topics that we were talking about today, please let Alex know and I will email them to you so that you can follow up on whatever you think is going to make sense to you. So with that, I know that was a lot of information. I thank you guys for your patience. Do you have any questions for me or specifically for our nurse and occupational therapist? Yes?
I am diabetic. I have no feeling in my feet.
Yep.
So I have to take precautions to deal with that, and I do deal with it. I have multiple handholds in my shower. So I have a place to hold on to as I'm in the shower.
Which is great, which is wonderful. We like to see that. A lot of times when people are coming home after a fall, they've been in rehab, I know for our caregivers, the care plan will say they're to be sponge bathed, not showered, until some of these things can be put in place by the occupational therapist. So good for you. That helps keep you safe, and that's a smart thing to do. Do you have anything?
Yeah, with especially with diabetic neuropathy, so that feeling of not having feeling in your feet. When you have something like diabetic neuropathy, so when somebody has lack of feeling in their feet, even in a tub, it can be hard to kind of gauge where your feet are. So grab bars are great, but also adding a shower seat or a shower bench can be great. That way you don't have to worry about keeping your balance while you're standing. You can actually have a seat in the shower, so you're not really worried about trying to find out where your feet are and if they're on a level surface, if they're safe. If you sit down in the shower, it's a nice, easy, relaxing way to bathe yourself, and it's much safer as well.
Absolutely. And could you talk a little bit about the difference between a transfer chair for the shower and a shower chair and water transfer? Might be helpful?
So there's a couple different options for seating for a shower, depending if somebody has a tub or if you have a walk-in shower. There's a couple different things that people like to do. If you're able to step up and over and into a tub and you have grab bars, sometimes just a standard shower seat is appropriate for somebody. That way you can step over the edge of the tub, hold on to grab bars, and sit down. For some people, the action of stepping over a tub is no longer feasible for them, depending on what their injury was, or if they have arthritis or lack of mobility in their hips. So they make what's called a tub transfer bench, which looks like a seat with an extension that comes out over the tub. I have a flyer up here that has a picture of it on the back so you can see what I'm talking about. But that way, somebody who's outside the tub, you sit on the edge that comes out, and you can kind of just help your legs in and slide into the tub. They actually take those a step further, and they have ones that actually are on a slide that will slide somebody in or out. So if you're really having difficulty and you need somebody to help you, that action can actually be done mechanically. So there's a lot of different seating options that are out there. But grab bars are really, really important for anybody of any age in a shower. I know I've slipped in a shower and wish I had a grab bar to grab onto. And there's other options too for tubs. You can have somebody do what's called a tub cutout. I don't know if anybody's ever seen that, but they'll actually take the edge of a tub towards the, obviously not where the water's flowing, but the opposite end, and they'll make a cutout so somebody can actually walk in and out of their tub without having to redo the entire bathroom. So there's a bunch of different options for safety around that.
And as we've aged as a society, more and more of these things have been developed to help us. And so what you say, well, I might have looked at these devices years ago for my mother or whomever, it's very different nowadays. There's a lot more out there, a lot easier to work with.
Even having like a spray shower, like
Yes.
having a handle
Handheld.
come down, that makes it a lot easier to spray. You're not dealing with the rushing water all the time, and then you can stop and soap up and then rinse off. It's a lot easier to have that, you know, as an option. They make so many of them now.
Especially if you're seated, yeah. If you have a tub.
Yeah, it's a lot easier.
Yeah.
Absolutely. Any other questions, comments, concerns? Questions for a nurse, occupational therapy? Yes.
Okay, so the issue I have with my house, it's a great house, I'm glad I got it, it's an old house, is my stairs. My stairs, I got 2 brick walls on the side, they're steep, and I have one handrail. Is there somebody that could come by and look and, I mean, I'd even be willing to modify the whole stairs, make them wider and shallower. Is there somebody that specializes in that kind of?
There are a couple different contract agencies that are out there that do home modifications. So I would start with a Google search of contracting home modifications. Or you can post on, you know, the internet's kind of a wonderful thing at these kind of times. So you can post on a group like Nextdoor or on Facebook and ask if anybody knows of anybody that specializes in modifications of stairways or can drill into that brick, because sometimes that's a problem too. You have to get certain types of equipment to be able to drill into brick to make it secure. But that's where I would start. But there's definitely more and more contractor companies are now getting into that realm because they know that our seniors are aging. They know that our seniors are becoming more, there's more of them with the baby boomer generation, and they want to stay at home and they want to make their home as safe as possible. So that's probably where I would start with that.
Yeah, and one comprehensive one, and I'm not promoting this, but I know that I have heard good things about HomeAdvisor. And the reason I like that website is you type in your address, you put specifically what you're looking for, and they will let you know who in the area they've gotten good reviews of to perform this work. Because certainly, you want to make sure that whoever does the work, it's bonded and guaranteed, so the first time you grab a hold of that railing, it doesn't come out of the bricks.
Right.
So that's an option too.
Okay.
Other questions, concerns, topics that you might have a question about that we didn't?
I live in a 9-room house, alone, with 4 cats.
Okay.
And the first floor bathroom, the people before me were elderly, and there is no tub.
Yep.
You walk in over a lip of 2 inches,
Yep.
and it's a shower, flat.
Yep.
You stand there and you get a beautiful shower. You come out, you towel yourself off, never have a problem. There's a bathroom on the 7th floor, no tub. Again, they put in a shower, just a flat
Yep, that's what we call the walk-in showers.
walk-in shower with a lip this much.
Yep.
Like a 1.5 inches. So I never have a problem,
Good.
because I don't like the tubs that are curved like this,
Right.
because you can slip in them.
Oh, yeah.
Very easily.
When you got soap on you and you're wet,
Absolutely.
you're gonna slip yourself.
Yeah, happens all the
And
time.
that's something I tell our caregivers. If you are assisting someone with a shower, particularly with the handheld shower head, you have those, before that person goes to stand up, you want to rinse the floor, you want to take your fingers and touch the floor to make sure it truly is safe to stand up, because for exactly that reason, any type of products that you use, personal care products, can adhere to the bottom surface.
Hairspray, anything.
Absolutely everything. And one of the things about the walk-in shower that you mentioned, I just want to give one little caveat to that. In a lot of instances, if people are going through their bathroom and redoing it to make it better for aging and safer, they'll put in that walk-in shower and they'll use those glass doors. Oh, they think they're so easy to clean. They're also a hard surface that if you did slip and hit, that would be a problem. So if you do use a walk-in shower, I know I prefer, probably you prefer to see the old-fashioned shower rods with a shower curtain, because that's just a safer option. Very good. Yep, exactly. Any other tips, suggestions, concerns? Yes?
Make sure you get a bigger toilet,
Yes, that high toilet, absolutely.
and they're not expensive either.
No, they're not.
There's also options too, if you need something in the meantime before you can get a plumber out there to give you a new toilet. They do make toilet risers, so it'll give you about 6 inches, 5.5 inches of height to it, so it's not such a low surface. So in the interim, you're able to modify your current toilet so that you're able to get on and off of it a little bit easier.
Just make sure,
Right.
just
Yeah.
make sure before you sit on it, you give the handles a little jiggle.
That's
I
right.
have seen them loosen up and you don't want to be falling down. But another benefit of those higher toilets is that they're longer. The toilet bowl is longer than they used to be. So if you are doing a sponge bath, for example, instead of doing a shower, you don't even have to stand up to be able to wash, as the Brits would say, all the dirty bits, because it does have a lot more room and flexibility for you for that. So there's a lot of new things out there that really are a quick fix, like you said, that can absolutely help keep you safe. And again, we're particularly talking about the kitchen and the bathroom. Falls can happen anywhere, but those are the most likely culprits. Any other questions,
Another
suggestions?
comment too, with technology now, you have the Lifeline and the Life Alert, those, the necklaces and the watches that people have. But there's also a great thing called Alexa that's out there, so if anyone has their home that's technically savvy, you see the commercials for Alexa, play that song, and they'll play a song. But you can also use Alexa if you have a fall and you don't have a cell phone on you and you are stuck in the middle of the room and you can't move. You can actually ask Alexa to call 911. You can ask Alexa to call your daughter. You can ask Alexa to help you do anything. So it's not just Amazon's Alexa, but Google Home. There's all sorts of other technologies that's out there that people can use to actually help themselves stay safe and get the help they need when they need it.
That's a great idea. That's a great idea. Well, thank you. I hope that this has been helpful for you all.
I teach the Tai Chi and Qigong classes. Now, most people have heard of Tai Chi. Fewer people have often heard of Qigong. I want to briefly explain what Qigong is, and you'll see that they are really two sides or two aspects of the same thing. Qigong is a giant umbrella that covers an awful lot of practices in China. In fact, Tai Chi and Tai Chi Chuan are both practices that fall under the umbrella of Qigong. Qigong, when you translate those two words, is basically Qi is the life force or the living force, and Gong is work, but it's not just the term labor. It's work that implies things like farming, something that cultivates and grows something. And in this particular context, they're specifically talking about an internal skill. So Qigong is a work that cultivates the internal skill and development of the life and living force to improve longevity and the strength and vitality of the body. So Tai Chi falls under that umbrella, and in the Tai Chi class, we begin with a series of Qigong warm-ups. So you're going to get Qigong no matter what. If you go to almost any Tai Chi class, you're going to see they do Qigongs as part of their warm-up, but it's less focused on just the Qigong. You start teaching the form of Tai Chi. In our classes, we do the same thing. We spend a good half hour usually in Qigong warm-ups, and then the rest of the time is spent in exploring the Tai Chi form, so that you have something you can practice over and over again. Qigong, in our Qigong classes, which is our evening class, our Tuesday evening class, in that class we do the same warm-up, but then we explore one of the Qigong forms, or sometimes two, if they're very simple forms. Today, since we're focusing on fall prevention, we're going to take certain elements of the basic Tai Chi and Qigong warm-up, things that are specifically relevant to balance and the strength and pliability necessary for very good balance. So, and I want to invite everybody to follow along with this as much as they can. And one of the things that I always teach in all of my Tai Chi and Qigong classes is that you have to listen to the body. A large part of these arts is developing a relationship between the mind and the body, such that the mind learns how to listen better to the body and make adjustments to whatever we're doing. To that end, Tai Chi and Qigong are not performed like classical, fitness-based exercises where we go with the mindset of no pain, no gain. In Tai Chi and Qigong, we're looking for calm and relaxed. We want to always be calm and relaxed. We always want to be centered and grounded, meaning we know where the center of our gravity is and the center of our body because we're going to move from there. Grounded means that we have a good and stable, balanced relationship with the ground. And we're going to make these primary principles the basis of everything we do. In addition to those 4 principles, we also have whole and complete. We want to learn to feel our whole body and develop a deep relationship from the top of the head all the way to the bottom of the feet, from the front all the way to the back, from the left all the way to the right, from the inside all the way out, and into our personal space so we can feel what's around us. A large part of learning how not to fall is learning to experience the world that you're interacting with so you don't get surprised by something and throw yourself off balance. Okay? And this is, when you really think about that, this is an awareness art. Both Tai Chi and Qigong are deeply about learning to become very, very aware of your own body, your own momentum and action, gravity and how it's working through you, and your interaction in the larger world. Okay? And then the last of these principles, the last 2 principles are called alive and lively. Alive means it's active. It's not placid and flaccid. We want to be relaxed, but we don't want to be relaxed in such a way that we're collapsing anything. Everything wants to be active. Lively means it can all move. The whole body is fluid and free. Nothing is held rigidly. This would be alive, but not lively. This would be lively, but not alive. We want the perfect balance between that. We're going to try to do that with our whole body all the time. So I needed to convey those principles before we even started. Now, the first thing we always learn to do is to adopt what we call the Jianzhuang posture, which is the basic post stance, meaning like as though we were standing on 2 posts. Now, again, you must listen to your body. So any rules that we make or that you learn in Tai Chi and Qigong are more guidelines. They're things to aim towards, but if in the process of trying to adhere to these guidelines, it creates undue tension and conflict internally, particularly around joints, then you need to make a modification to the posture such that it's no longer putting that kind of pressure on your body, because anything else would be violating the first of those principles, calm and relaxed, right? So the basic posture is roughly shoulder width and feet generally parallel. Now, most people are tight around the hips and they can't get the feet parallel without tension forming on the side of the knees. If that's you, let your feet turn out. That's fine. Other people sometimes have some fallen arches and their legs collapse inward like this. All we're going to do there is try to gently open up the legs. If it collapses inward slightly, we just want to encourage in the direction. All corrections in Tai Chi and Qigong are gentle. Nothing is forcefully done, ever. We want to learn where our limits are and operate within them, right at the edge, not force past them. Because here's the principle or the idea behind this. When you consistently work at the edge of your actual limit, your limit naturally expands. Your strength naturally expands. Your pliability naturally expands. and your flexibility and responsiveness naturally expand without having to use a lot of force. Because at the edges of our limit is not normally where we work. We work further in, and the limit is created further out. So if we work closer to the edge of our limit, that becomes the new middle. And further out starts getting easier. And then we continue to move like that until eventually you find yourself having a level of strength and pliability you never expected. Okay, let's talk about a couple of other principles in this standing. One, we never want to lock our knees. Our knees are always slightly bent. Our hips are always slightly bent, like we're about to sit down. So imagine you're standing, and there's a chair, and you're just about to sit down. That very first motion that you make to fold in the knees and hips. And then we're going to learn to keep this as our base standing posture. Why do we do that? Two primary reasons. One, it develops the power of the legs. Legs are an important part of the strength and pliability and core strength required for good balance. Okay? Two, when our legs are slightly bent, we're adaptable, and we learn to become relaxed in this position for longer and longer periods of time, which builds endurance. Consequently, when you find yourself walking for any distance, it's no longer tiring. It starts to become easier and easier. And we're looking for this for a natural level. Now, at some point in classes, people always tell me, oh, this starts to burn my legs. If you need to take a break and shake them out. This is always a viable option. Again, it's not a fitness class, and it's not a contest or an endurance contest to see how far you can go. The whole goal is always to stay calm and relaxed, right? And centered and grounded. So once we unlock the knees and unlock the hips, we have a soft buoyancy here. We want to learn to feel our center line from what the Chinese call the bai hui, which is the point at the apex of the head, right to the hui yin, which is the point at the bottom of the pelvic floor. And there should be a straight line. We should feel almost like there's a little string attached that helps to hold us up, and we can relax our whole torso down so that the low back relaxes, the tailbone drops, we relax the lordosis down here, and we naturally let the weight drop right down into the ball and socket joints of the hips, and then our soft buoyancy allows it to go down into our legs. We are now no longer holding our bodies up through tension in the back, but instead through alignment with gravity. We are putting our weight on the bones where it belongs. Most people believe that we hold our bodies up with our muscles, but we don't. We hold our bodies up with the bones, and we keep the bones from moving with our muscles. There's a big difference. So don't look for holding, instead look for settling. You want to settle onto the bones and then have a soft pliability. Now, the very first exercise we always do in all of our classes is a bouncing expansion. And the reason why we do this, it teaches us about where we tend to wobble when we move or when we stand. So I want you to feel what's called the triangle of the foot, which is a triangle that forms from the ball, across the ball of the foot to the heel. This is the primary load-bearing member or load-bearing region of the body. When you put your weight down, it needs to go through the center of that triangle. If you're on the outside of the triangle, you're moving outward, and you now have to tighten things in order to have better balance or to not fall over. If you're forward, and everybody try this, move forward into the ball of your foot, you'll feel your shins tighten, and you have to kind of adjust your body with tension in order to maintain your balance. If you go back, the same thing happens. You have to make an adjustment. Most people make that adjustment by pushing the hips forward. Now, the quadratus lumborum here in the low back have to hold your upper body up. That'll get exhausting after a while and create undue tension in the body, which then makes your body less responsive, less able to adapt and change when you need to quickly to restore balance if you start to lose it. So we find that center point in the triangle of the feet, and then we feel this center line, and what we're going to try to do is make this center line go straight up and down like a carousel horse. This is the bouncing part of the expansion. And we start slow first, and we try to feel like the weight goes straight into the triangle. Now I want you to feel your structure. There are two primary lines that go from the shoulder right down through the feet. And if we keep those straight, it helps to keep the center line straight. Now, a lot of times people start to notice all these little tensions in and around the hips that cause people to unevenly bend. Well, that's okay. Just don't fight with yourself, ever. That is not part of Tai Chi and Qigong. Tai Chi and Qigong is about learning how to let go into a natural alignment. Once we have that, we add in a little movement with the arms. We expand out as our legs expand out. So as we straighten the legs, we bring the arms out. Of course, I never quite lock my legs. Now, the best part about this movement is this starts to teach us the basic movement for getting up and down out of a chair. I'm going to borrow this for a second, and I'm going to show you something. I teach a strength, flexibility, and balance class somewhere else as well, and we literally practice getting up and down from a chair. And I encourage everybody to do the same. And the reason is it builds all the core strength muscles that make for really good balance. So once we have our basic structure and triangle of the foot, what I'll do if I want to sit down is I'll just keep going straight down. Now you'll notice I try to keep my body straight up and down, and I just look up slightly and I place myself right down. Now when I train people to do this, and I do this sometimes in some of my Tai Chi classes too, I want people to learn to get up and down without lurching forward and without plopping into a chair. Like most people sit down and this is how they sit. Right? If you have a rolling chair, that can be dangerous. If you have a folding chair, that can be dangerous. And if you miss, that can be dangerous. And more importantly, it doesn't allow you to exercise the deep core muscles that provide the strength and pliability and base stability for really good, solid balance. And that is the basis of all fall prevention. So I tell people to, every time you get up and down from get out of a chair, try doing it twice. And just doing that, making that one little adjustment, every time you get up and down from a chair, start from a good posture, get up, and then move back down nice and slow to like a slow count of 4. 3, 4, place yourself in, get a good posture again, feel your center, try to push straight down through the triangles of the feet, and come straight up. Then go and do what you were going to do. If you did that every time you got in and out of a chair, I guarantee you would start to find your core strength and your leg strength increasing. And you'd start finding your balance getting better just from that. That is a very powerful and easy adaptation to make. Okay. Now, if you really want to exercise it, pick a time in the day and do about 8 repetitions of it, where you're just going up and down nice and slow. You're feeling that center line. You're going down nice and slow, right through the core. Place it down. Feel the center, the triangles of feet. Always take the time to be conscious of the particular alignments you're working with. That is the heart of Tai Chi and Qigong. It's conscious interaction with your body. We do so much unconsciously. We go through our lives, we think about where we're going. We think about the taxes we need to pay. We think about all the things we have to do, the people we care about. And instead of thinking about what we are doing, as we age, it is far more important than ever that we become conscious and consciously aware of what we're doing with our bodies, and more importantly, how we're doing it. Aligning ourselves to good postural technique, again, from the core and up. Now, sort of the advanced version of this that I do with some of my classes after they've taken it for about 6 to 8 weeks and we started to work, is we'll do nice and slow, go all the way down, touch, but don't sit, and come back up. Then go back down again, right away without much rest, and place yourself down. So those are some just basic exercises that we can do. In Tai Chi and Qigong, we also have some other exercises. Now I'm giving you a very quick survey here, and this isn't much of a full class because it's not designed for that. It's to introduce you to some of the stuff we do. Another thing that we do in class is we stand on one leg. This is an important part of balance practice, okay? Learning to align ourselves straight into the triangle of 1 foot. Now, the how you go about this is important. Most people stand by thinking from the top down. They try to bring their chest over and put it down, and they stand on top of their tension, and then they try to pick their foot up, and of course there's some unbalance in there. Would you try to build a house from the roof down to the foundation? You shouldn't stand that way either. You should always stand from the ground up. So the first thing I do is, being in this soft, buoyant, sunken position in my legs, I slide my weight over into the triangle of 1 foot. I make sure the weight's going straight up through the knee, hip, through this side, and then I shift so that my center line and this side kind of come together at the hip into the triangle of the foot. Now I'm ready to completely pick up the foot. And then I put it back down. And I can shift, and we practice doing this in some of my balance classes too, where we shift over into one and pick up. Now you'll see in our Tai Chi and Qigong class we do this as well, but it tends to be within the context of various forms. For example, there's a white crane Qigong that we do that looks like this. And I invite you to join along. You start here. Now, in Qigong, there are what are known as the 3 adjustments, or 3 regulations. Regulation of the breath, regulation of the body, regulation of the mind. Meaning, what are you doing with your breath? What are you doing with your body? What are you doing with your mind? The body, we talked about the basic principles and how we're going to shift back and forth as we move and move into one leg. In the breath, we're going to just breathe naturally, but coordinate the breath with the movement. And then what the mind is doing is learning to feel the whole, in this particular Qigong, and the center line, and making sure we have good upright relaxation and the coordination between breath, body, and mind all coming together as a unity, not 3 separate pieces. So we start here, and we begin with an inhale up. You notice I rose up through the legs, so I'm almost straight through the knees, but not quite. And I exhale down. And I sink into the legs. Now you can see this is some exercising here. And up. And I look up when I go up, and palms out and down. Now think, this comes from white crane Qigong, so think like a crane. Imagine you're a crane and you have wings. And when the cranes open their wings like this, they actually inhale. And when they close, they exhale. I'm going to do it one more time. Notice my center line is straight up and down. I never look down and collapse. Then we're going to shift. When we get halfway, we're going to shift to one side into that triangle of the foot. And we're going to pick up the leg. Inhale. Exhale. Put it down, heel, foot. Then we're going to shift straight into the triangle and press up as we come up. Now I'm really focused on the leg I'm weighted in, which is my front leg. Then as I exhale, I bring the heel down. I shift back. I pick up again. And I put down back to the shoulder width. And I go back up in the center. And down. Then I shift to the other side, triangle of the foot, feel that, take your time. Pick up the heel first, then we inhale up. And exhale down. Heel, foot, shift, and down. Pick the foot back up. Come back to the center. Now we're going to do a real challenge. We're going to come up. As we come up, we're going to try to push up into the ball of the feet. Now, the key here is to go only as high as you can go with complete relaxed control. It's not about getting as high up as you can get. It's about, as you go up, you press through the ball of the foot and then back down. You see that slow control develops all the muscles of the lower leg and the stability control that happens from that lower leg. So let's try that one again. Come up. And if you need to adjust, then you adjust. Stop and slow down. right?
Supposed to be breathing at the same time.
That's correct.
Right, in and out.
Inhale up, exhale down. Let's do it one more time. Inhale up. And exhale down. Now we're going to bring our feet together. This is called close or sao. You take a deep breath in, and you're just letting your mind go through your whole body, from your fingertips, through your arms, through your shoulders, relaxing everything as you go. Relaxing your head, relaxing your neck, your shoulders and your chest, your torso, your hips and legs as you exhale down. Releasing tension as you go. This allows the Qi to flow more freely. There is so much more to Tai Chi and Qigong. I was only able to introduce a couple of basic practices. There's a lot of baseline information and knowledge that you start to get as you do more and more. I can't possibly ever teach it all, even in a week. It takes years of practice to really understand an art like this. The great news is, I've been doing this for 30 years. I've never run out of learning. I still learn every time I practice, because our bodies are so infinitely complex, and yet they just follow some good basic rules. And by learning to do so, we can develop a deeper, stronger, better relationship that brings us more natural balance and health. That's the basis of Tai Chi and Qigong, is that balance, the physical balance, is a reflection of your mind-body connection and the natural balance that you have of being relaxed, calm, and peaceful in your being. They promote that as the basis of balance. I want you to think about this, how much your mind plays a role. Think about when you're scared or angry and how your body reacts. It tightens up, it lifts, it pulls you physically out of balance as well as mentally out of balance. You can always be better balanced when you're calm and relaxed, centered and grounded, whole and complete, and alive and lively, meaning you can respond to things naturally without frenetic or anxious activity, because those things are the beginnings of the loss of balance. That's what we teach in Tai Chi Qigong. Now I'm going to turn this over to my compatriot over here. Please welcome her to, you're doing yoga, right?
I'm doing
some yoga. Okay, thank you very much.
Thank you. Hi, I'm Louise, and I agree with everything you said. I'm probably going to say a lot of similar things, but in a slightly different way, coming from the context of yoga. So in yoga, we have what are called asanas, or postures. And I think one of my favorite and what I think is the most important postures are Tadasana and Dandasana, and they are all about posture.
I couldn't understand the words you were saying.
Louder. Asana means a posture. It's a position you put your body into.
Okay.
Okay, and so Tadasana and Tadasana and the other one are seated and standing. So let's just zero in on posture a little bit more. Again, even if you're sitting in your chair, the direction you're going in is to feel your pelvis under your ribs and your head over your ribs. Okay? And then like Jeff said, we never want to lock our knees. So let's just bend the knees a little so that you first feel what it is to feel locked knees, which is stressful to your ligaments. And then just release them a tiny bit. Okay? So then we're just going to stretch out fingers and toes, because the more we stretch out the fingers, I find the more my toes can reach out. So even if you're in socks or shoes, just try and, reach out. And I try to reach out more into the baby toes and the fourth toes, because we have less feeling there. And we want to strengthen the outer edges of our feet for balance. Like he was talking about a triangle of the foot, right? And I tend to think of inner, middle, and outer foot. So we're reaching more out into the outer edge of the foot to wake it up, essentially. In yoga and Tai Chi, we're trying to wake up the body and bring break through patterns of living in our body that aren't really serving us anymore so that we come into more balance. So just stretch out your toes and think about planting them down, reaching out. And this immediately connects you more with your lower body and is going to help with posture and strength and all that. So then we're going to bend just a little bit. Take your tailbone down, bring your tummy in, lift here, and let your head come back. So we're talking about alignment of pelvis under the ribs, head over the ribs. And this should feel good. When you are in this alignment with your bones holding you up, like Jeff said, you should feel lighter because your muscles are not straining to hold you sort of like this. Your head's too far forward, your butt's too far out. Okay? So that's coming down, the pelvis is coming down, the head's coming back. And then just come to your abdomen and take a slow breath, breathing here, letting your abdomen gently balloon out as you inhale. And when you exhale, gently bring your abdomen in toward the spine. So the longer you do your practice of yoga, the better the alignment becomes. So if you're sitting in a chair working on Dandasana, I couldn't think of the name, it's the same principle. You want to have a right angle at your hips like the chair pose, and then you want to bring your head back, bring your abdomen in slightly, so you feel pelvis under the ribs, head over the ribs. So let's just play with the head for a second, just slouch. Okay, so that's going to throw off the position of the pelvis, making your butt stick out. Okay, so now bring your head back, drop your tailbone, let your abdomen come in slightly, and belly breathe. Nice, slow, and on the exhalation, just relax from the shoulders down. Let the head come back maybe a little more. Imagine a little hook lifting you up from here. You're relaxed from the shoulders down except for a slightly active core. And then go deep inside and think about lifting from the back of the heart or the front of the spine so that you're not slouched. So that you're open. All your internal organs have more room to function when there's more space for them because you're not slouching. Okay? So now coming, and you can do this in a chair too. So feet under the hips, and we're bending. Tailbone down, tummy in, lift here. And we're just going to go up and down, side to side on the balls of the feet, keeping the knees bent. In fact, the more you bend your knees, the more stretch you will get. And what we're focused on a lot in Hatha Yoga, which is what I teach, is posture and keeping full range of motion in the joints so that you can have good posture. Okay. So now just take your weight to the left leg, keep your knee bent, and slowly circle the ball of the other foot. So feel inner, middle, outer ball of the foot. The more you deepen your awareness of your feet, the more that will keep you balanced and avoid falls. So I like to say at this point, now let's feel inner, middle, outer ball of the foot, so that you're just more and more grounding in the lower body. And then reverse it, and move so it feels good. Everything should feel good. And I like to feel playful and curious when I'm doing my yoga. How does my body feel in relation to this movement right at this moment in time? Okay, let's shift to the other leg, and we're going to feel inner, middle, outer. And then feel inner, middle, outer, outer. So you're investigating. How does this feel? Deepening awareness. And reverse it. Good. And then look down, because your feet may have shifted slightly, and place them parallel to each other again, allowing for, adjustments that you need to make so that everything feels good. Everything feels really good. Yoga is not the philosophy of no pain, no gain. It's about working with your body in a loving way and acknowledging that your body is doing the best that it can. Always moving toward healing. Okay, so now we're going to bend, straighten but don't lock, releve like ballet class, and down. And down, up, up, down, up, down, up, down. So now you're going to feel if your Achilles tendons are tight, the backs of the ankles. Just notice and move so it feels awakening and stimulating to wherever you're feeling tightness. So now we could add working with balance. And in the class, I encourage people to be next to something if they feel they can't do the balance pose, so that you might need a hand or maybe even just a couple of fingers to float the arms up, but you might have one here. And then you're just going to rise up onto the balls of the feet, go up and down as you need to. Relax the shoulders, engage the core, keep the tailbone long. Think of that posture, Tadasana, that I talked you through. Pelvis under the ribs, head over the ribs. And then if it's too much to have your arms up for a while, just have them rest at your sides. Focus on a point, eye level or higher. Balance poses are about concentration and strengthening. Good. And then walking. So when we walk, we want to roll the foot. You can join me. And I encourage you to reach behind towards your elbows. This will keep your shoulders back and down. So when you walk, you're going to look out and you're going to feel your feet. You want to feel a natural walk, but being conscious of rolling of the foot, heel, ball of the foot, toes. So look out and just enjoy the walk, a nice conscious walk, which is walking meditation. So we walk a lot during the day, just make it as conscious as you can. So here I'm trying to feel pelvis under the ribs, head over the ribs. So for me, that's always bringing my head back. Because just notice, we tend to be here, and this is really where we want to be. We've got bones holding us up. Okay, so now I just wanted to demo a couple of things we do in the chair to promote balance. And one of them is, it's also good for the brain. We do opposite arm and leg, and remember Jeff was talking about the importance of strengthening your quads, strengthening these muscles. So join me if you want to. And I have an active core, but my first focus here is my posture. So I could do this like this, and I might get more movement, but what I really want is to have my pelvis under my ribs, head over my ribs again, which makes it a little harder.
Standing up.
Okay. And then we hold. So we relax the shoulders, engage here, and I'm reaching through my heels, flexing, active heels, and release, stretch, release. And then we do it with a different posture, boat pose. So the arms are parallel to the floor. And each time I'm really reaching through my heels. So if you're feeling these muscles, you're doing it right. And then holding. So I'm lifting here, shoulders relaxed, release, and hold, release, hold. Good, and then chair pose. Just relax your arms, bring your elbows back, same leg movement. So the heel, reach through the heel. And if you want a deeper work, you could come forward in your chair, keeping this right angle at the hips, just like the chair. So are you feeling your quads? And holding. And then let's just rest with a belly breath or abdominal breath. The importance of being relaxed. Things go better when we're relaxed. So that's where we can make the breath a real ally in our life by consciously breathing. So just place your hands on your abdomen. And when you inhale through the nose, just think of ballooning the abdomen out. Slowly and gently, and when you exhale, gently bring the abdomen in towards your spine. Relax the shoulders, bring the head back, drop the chin. Relax the lower back. Relax the pelvic floor. So you're relaxing the lower spine that way. It's like you're growing the lower spine. And then when you bring your head back and you imagine a hook lifting you up from here, you're opening the neck, the top of the spine, so you can grow your spine up and down. And in yoga, a supple spine is seen as the key to health. Okay, we have a natural curve.
It's what?
Seen as
Keys to health.
the key to health. Yeah. And remember, we don't have a straight spine. It's naturally curved. In at the neck, out at the rib cage, in at the lower back, out at the tailbone. These curves become exaggerated, so things get compressed. Okay, so we want to have a nice open spine so all the nerves can fire all the signals to the body to help you stay in good posture and balance, preventing, falling and tripping, those sorts of things. So then, another thing I do to open the pelvis, which is going to be so important for your walking, the bones coming into the hips and sacroiliac joint, is I work with a modified lotus pose. So if you want to come onto the edge of your chair more, and this is actually very nice for the hips if you step your feet apart and just rock your hips side to side. Because what so often happens when we fall is we end up with some kind of hip problem, right?
Yeah, we got it going.
So, yeah, you gotta go the same way there. And so we want to have the pelvis in good shape. So you would step the left foot in front. Now here's the more advanced, you would bring the foot up here. If that is not possible, you cross at your ankle. Okay? And then you just start circling around. Slowly. And do you feel that in your hip? Getting all the tendon attachments. And just think about keeping your chest lifted and letting your neck and head roll. And then reverse it. So I'm doing these rather quickly. Really focusing on them in class. And then bring your hands under your knee and just pump the leg to bring the blood through the knee joint. Keeping the knees strong. And I flex my foot here. And then we're going to shake out. Put the heel down and rock the whole leg. And then to keep balanced, we have to do the opposite side. So this could be very different. Check in. How does your hip feel? On this side, can you get it up here, or do you need to be down here? Okay, attuning moment to moment and making adjustments so everything feels good. It just feels like you're waking your body up in a different way. And honestly, I think this is one of the most important things that I teach, this modification to lotus pose. And you do what? Lotus pose. And reverse it. Good, so then we're going to pump again. And shake it out. And rock it. And then we take it up a notch. So you could be here or here. And just switch legs and circle a little bit. And then we prepare for a forward bend. We turn to the right, inhale the arm back and up. Exhale forward and down, and we just gently rock here, inside the knee, outside the knee. And I flex my foot, and if I want more stretch, I lift here. Okay, just getting into those hip sockets. Can you feel it? And this is also very good for preventing sciatica. Good. And then we shake out and rock. And step the foot down, coming right out from the hip for good alignment. Pick up the other foot. Now I like to move around the chair. The chair is actually a wonderful prop supporting what we're doing here. And circle. And then we're going to turn to the left. Inhale the left arm back and up. Exhale forward and down and rock inside and outside the knee. So again, feel playful and curious. What are you feeling? You're investigating your body here, deepening your awareness. And it becomes more and more of a focus as we age, right? So let's let it be as playful and fun as possible. Good, and shake it out. And rock. And by the way, Thursday morning when I teach from 11 to 12, that class focuses on lower body yoga. It's incorporated into all the others. But because I think it's so important for balance and preventing falling and things like that, I'm lucky to be able to teach a class that focuses on it. So let's just finish centering with a belly breath. How slowly can you breathe in? And again, coming into better posture. posture on the exhalation. Relax from the shoulders down. Let your head come back. Drop your chin. Relax the pelvis, the tailbone, the pelvic floor. Feel your feet. If you want to feel more grounded, we have a pose called tree pose. Send imaginary roots from the soles of your feet deep into the earth, creating a strong foundation of strength and balance. And from that foundation, breathe up through the trunk of your body. This is tree pose. Reach up and out with your branch-like arms into more freedom, opening, expansion, because you are grounded with your roots. Lift your heart, shoulders relax, and release to your heart. Om Shanti is how we finish class, and that means peace. Okay, thank you very much.
Thank you.